So I think it's really important to like identify that when we talk about the Black community in Toronto, it's not a monolithic community. It's quite diverse. I find that people under 30, I would say even under 40, are usually people that are open to the idea of like seeking therapy. Especially folks I find that experience like multiple intersections, such as being Black, queer, trans, non binary. Those are the folks that I largely work with that would seek mental health supports. And I think like generational also matters too. So it's different for people who have been living in Toronto or Canada for multiple generations, opposed to people that maybe they're first generation Canadian like me. Their tolerance level will be different when it comes to like the healthcare system and mental health and talking about it. But I find with people, especially folks under 40, like that stigma is not so much there. Folks that, don't really necessarily engage with other areas of healthcare, those are the people that I probably don't meet and I don't have an opportunity to engage with. There's a lot of diversity in the Black community, not just about, not across like sort of sexual orientation or gender. There's a lot of diversity around political lines, diversity around income, and diversity in terms of like identity. So there's folks in the Black community that wholeheartedly identify as being Canadian because their ancestors have lived in Canada for 7, 8, 10, and more generations. And that's largely the people I engage with, or possibly from the East Coast that have that rich history. As well as I work with folks that are like, again, like me, first generation Canadian. Their parents maybe came to Canada in the 60s during the major migration period in the 60s in terms of the labor workforce in Canada. And were born here. Healthcare system, they're like a fish in water in it. Some of that stigma doesn't really exist for them. But it's when I think about people like from like my mom's generation, the stigma is there where it's like, mental health or seeking therapies for people who are really unwell or people that have multiple mental health diagnoses. That's sort of like the imagination. But when I think of like my cousins and my friends, that's not the perception at all. It's quite the opposite.